Hi, I'm Dr. Anthony Larson. Today we're going to talk for a minute about your options for replacing a missing tooth. Once a tooth has been lost, there are several different options that you have in what to do. The first option actually is to do nothing and not replace the tooth. I would certainly talk to your dental professional about this and say, if I do nothing, what are the long-term implications? Typically, if a tooth is not replaced, the adjacent teeth will move. Teeth are surprisingly mobile. They stay in place because the lips, the tongue, the other teeth help to keep them in place. But when a tooth is lost, the adjacent teeth will likely tip into the space, and the opposing tooth above or below the missing space tends to push up, trying to find a tooth to hit against. This is called super eruption. And then lastly, when nothing is done to replace a missing tooth, there is some significant bone loss that can occur over time. So that is an option, but I would certainly discuss the long-term implications with your dental professional. The second option would be to place a removable partial denture in the space. A removable partial denture is something that is made of resin or acrylic and then may or may not have some metal in it. It comes out and in. It will stay in place. It is held in by the adjacent teeth, but must be removed daily and cleaned. This is a nice option for someone that's missing several teeth, as it's a lower cost to replace. And of course, the cost being lower is also a benefit to this option. The downside is that it is reliant upon adjacent teeth and puts a little bit heavier load on those teeth, and that it must be removed and cleaned regularly. Another option for replacing a space is called a fixed partial denture. Most people know this as a bridge. So a bridge is a good way to replace a missing tooth. The nice advantages to a bridge are that it's very quick. Within 2 to 3 weeks, the permanent restoration can be in place. They look nice and they do not have to be removed. So they do allow for good chewing and will stay in place long term. The downsides include the fact that it is a little bit harder to clean. You cannot floss and brush it like your other teeth because you have several teeth, 3 or more teeth that are connected. Another downside is that the adjacent teeth are involved in the procedure, and if you have a problem on one of the teeth in your bridge, then you have a problem on all of them. But it can be a good restoration in some cases. The last option we'll discuss today is a dental implant. This is considered the gold standard of options for replacing a missing tooth. The dental implant is a procedure that involves the placement of a post down into the bone. Typically this is a titanium, medical grade titanium, or it could be zirconia. Once this post is placed in the bone is given time to heal, and the bone will grow up around this implant, and the implant will become very stable and strong in the bone. Once it is healed, a dental crown can be placed over the implant. When the procedure is completed, the dental implant is a standalone tooth that looks and feels like a natural tooth, can be brushed and flossed in the same manner as the other teeth, and cannot get decay. So this is a great option. The downsides to this include that it does take between 4 and 12 months for the whole procedure to be completed, and there's typically more cost involved. But in many instances, the advantages far outweigh the disadvantages, and this is the option probably most recommended in the dental office.